Thank you for the opportunity to talk to you for a minute. You know, I know that there seems to be some disparity with Dr. Birx's opinion of Philadelphia as a potential hotspot as opposed to the City Health Commissioner, Mr. Farley, who seems to have a different opinion.
Well, what I can tell you and assure the people of Philadelphia is that every single day the White House Coronavirus Task Force starts the day by tracking those areas of the country where we have significant outbreaks. We've seen good news in California and Washington State where the cases are low and steady. It's a great credit to the people out on the West Coast who've put those social distancing measures into effect. We're obviously focused on really the epicenter of the coronavirus today in New York, New Jersey, Louisiana, and tracking Detroit and Chicago and other areas. But we also are attentive to areas where we're beginning to see cases emerge. And our experts have noted that the Philadelphia area just is at the very beginning. There's to begin to trend in a direction that we want the people of Philadelphia to know that now more than ever it's important to heed the guidance of Governor Wolf, to heed your state and local officials, to put into practice those principles of social distancing, personal hygiene that will ensure that the greater Philadelphia area does not have to endure what some other major metropolitan areas have endured. And we're encouraged by the progress across the country, but now more than ever, it's important that all of us do our part to implement what our state officials are directing. I spoke to Governor Wolf this week, but also all the guidelines that have been issued from the White House Coronavirus Task Force. And we can slow the spread and we can ultimately save lives.
Mr. Vice President, we talked to former Vice President Joe Biden a couple of days ago, and he said this, and this is a direct quote: "The president didn't cause this virus, but he reacted incredibly too slowly to it, didn't acknowledge that it's a federal responsibility to organize the response." How would you respond to Mr. Biden's comment?
Well, what I would say is that when President Trump suspended all travel from China on January 31st, which was something no American president had ever done. And on the same day, he stood up the White House Coronavirus Task Force. That decisive action at a time when we actually hadn't had a single case originate in this country bought us invaluable time to stand up a national response. And I think as the president would later begin screening all passengers from Italy, from South Korea, suspending travel from Europe, the UK, and Ireland, as well as spinning up a whole new testing regime around the country, which today now has exceeded more than 2 million Americans having been tested for the coronavirus. I honestly believe that when you look across all of the federal agencies that the president has directed in this whole of government approach, and also, candidly, Jim, when you look at the way that governors, regardless of their political party, have partnered with our federal government in ensuring that we promote the mitigation efforts, that we make sure our incredible healthcare workers have the supplies and resources that they need. I think every American can take great comfort in the way that leaders at every level have recognized that we're all in this together. And I promise your viewers that we're going to continue to take that approach every day until we put the coronavirus in the past and we reopen America.
In terms of reopening America and in terms of reopening the economy, will we have mass testing of the general population so we are equipped to keep infected individuals, especially infected individuals who show no symptoms, out of circulation? Sir, we haven't heard about plans for mass testing from the administration. And without it, my question would be, are we just setting the stage for another mass outbreak that would necessitate shutting down the economy all over again?
Well, as the president has said, we want to reopen the economy in Pennsylvania and all across America. When we can do so responsibly, and testing will be an important part of that. We're continuing to scale a whole range of new tests that have been approved by the FDA in record time. There's even an antibody test that is ready to begin to roll out and scale. Abbott Laboratories, now about 10 days ago, approved a 15-minute test that can be done on some 18,000 Abbott Laboratory machines that are all across America today. And that, with the public-private partnership that the President forged now a month and a half ago with large commercial labs in this country like LabCorp and Quest. As I said, we've exceeded 2 million tests today. We're testing about 100,000 Americans a day. But I think you make a very good point that our objective this summer, Jim, is to be at a place that we can go from what the experts call diagnostic testing, which is what we're doing today. That's trying to identify people that have the coronavirus and make sure that they get the treatment that any of us would want a family member to have, to what's called surveillance testing. And we have every confidence with the incredible response that we have gotten from laboratories and manufacturers that we'll be making all of those tests I just mentioned and more broadly available, so that not only can we reopen America, but we can make sure that America stays open as time goes on.
One final question, sir. A Reuters poll from yesterday said that 72% of respondents, and that includes 65% of Republicans, favor allowing mail-in ballots in the presidential election if the coronavirus pandemic is active in November. President Trump has made no secret of his intention to fight expanded use of mail-in ballots. Some opponents think or would characterize this as a move to suppress the vote. Isn't the president really asking Americans to come to crowded polling places in November and risk their lives in order to vote?
Jim, let me tell you, the numbers that I focus on every day are Americans that are losing their lives and Americans that are contracting the coronavirus. Ever since the day the president tapped me to lead the White House Coronavirus Task Force, that is our one mission, and we're focused as one team at every level of government in addressing that. And our ambition is, as all of us work together to implement 30 days to slow the spread, as all of us work together to heed the guidance of our governors and our state and local officials, we really do believe that we have an opportunity to put the coronavirus behind us sooner rather than later, to really be at a place even as early summer, Jim, where we'll have therapeutics that are available to give people greater relief who are suffering with the coronavirus, and we're speeding vaccines through the approval process and making sure that come this fall that we're in a very, very different place. And as I said, that we can not only reopen America this spring, but that we can get America to continue to go back down the road and do that safely. But I promise you that we'll continue to put the health and safety of America first, which is the mission the president's given our team, and it's a mission that every governor of every party is working on 24/7.
But some public health officials, including Dr. Fauci, I believe, speculate that, in fact, we may have a resurgence of coronavirus in the fall. Are you guys not thinking about any allowances for the November election and how that might have to be, how it might have to accommodate an outbreak of coronavirus? It's possible, sir.
Let me be very clear, Jim, that this is a new virus and we're studying it, but many experts believe that there may be a seasonal cycle like there is for the flu. But come this fall, I think people can be encouraged with several facts. Number one, we'll have new medicines called therapeutics. Number two, the fact that many people will have had the virus, including many that had either mild symptoms or no symptoms. There will be a significant amount, we believe, of immunity that actually is in the population. And then we're speeding through the process a number of promising vaccines, which we hope to have available. Usually a vaccine takes about a year and a half, but But there is something through the process called an efficacy waiver that if you have a promising vaccine, that it can actually be brought to market sooner. So maybe as early as 2021, we'll have a vaccine available for the American people. But what I promise your viewers is that all the decisions that we're going to make today, all the guidance and direction we're going to give great states like yours is going to all be based on the data and the information, and that'll continue to inform all the decisions that we make in the weeks and months ahead.
Mr. Vice President, a pleasure talking to you. Thank you so much.
Thank you, Jim.